Hi everyone, this is an anatomy and physiology video for healthcare students. In this video, we'll be talking about endocrine system anatomy and we'll be doing an overview. Let's start by discussing the 10 primary endocrine organs. You'll notice they're listed here: hypothalamus, pituitary gland, pineal gland, thyroid and parathyroid, thymus, adrenal, pancreas, and then finally the gonads, ovaries, and testes. This picture shows a mapping of where the endocrine glands are located. We're going to zoom in, however, and work through them one by one. Let's start off with the hypothalamus and pituitary. If you've already covered the nervous system, you may have recalled that the hypothalamus is part of the diencephalon of the brain. The hypothalamus has a close relationship with the pituitary gland. In fact, it is connected by a little stalk called an infundibulum. That infundibulum has not only a blood vessel pathway called a portal system, but also has a nervous system connection with the posterior pituitary. So the pituitary itself is two portions: an anterior portion that is made of endocrine gland tissue and a posterior portion that is made of nervous tissue. The pineal gland sits at the back or posterior side of the thalamus. The pineal gland only makes a hormone called melatonin. It regulates sleep and wake cycles. Thyroid gland is located in the neck. It wraps around the trachea. It's shaped like a bow tie. And you'll notice four nodules on the cutaway of the picture here. Those little nodules are actually parathyroid glands. They're found on the posterior side of the thyroid gland. One thing to keep in mind is not to confuse thyroid and thymus. Thymus sits in the chest under the heart, or sorry, under the sternum, over the heart, whereas the thyroid is sitting in the neck around the trachea. Those two can commonly be confused due to their close proximity. Here's a look at the thyroid gland in detail. In this picture, there are follicle cells that surround a lake-like structure that's called the colloid. Thyroid hormones are actually stored in that colloid for about a month's time. And in the background between those follicle cells are parafollicle cells. They secrete an entirely different kind of hormone that regulates calcium levels in the blood. Like we talked in the previous pictures, parathyroid glands are little nodules found on the posterior side of the thyroid gland. So they too are found wrapped around the trachea. Thymus is in the chest. It's over the heart and under the sternum. This one atrophies later in the teenage years because its job mainly functions in childhood years to help us program our immune system against foreign invaders. The adrenal glands are found on top of each kidney. Each adrenal gland has an outer superficial tissue made of endocrine tissue that's called the adrenal cortex. The deeper tissue is called the medulla or medulla. It's actually made up of nervous tissue. The cortex has three zones or zonas. They each secrete their own specific type of corticoid. So corticoid means I'm a hormone made by the adrenal cortex. It also means these are steroid hormones. So glomerulosa, fasciculata, and reticularis each secrete their own specific type of corticoid hormones. Our next organ is the pancreas. The pancreas sits behind the stomach. It's a triangular shaped organ and it has two purposes. It plays a role in the digestive system and it also serves as an endocrine organ. Since our focus right now is to look at the pancreas as an endocrine organ, we'll zero in on looking at those pancreatic islet cells. They're the ones that secrete hormones like insulin and glucagon. Those two hormones are antagonists that help to regulate blood glucose levels. Finally, our last two are gonads. These are ovaries and testes. ovaries for females, and testes to send outside the body for males. Well, I hope this video was helpful for you. If you have any questions, please leave them in the comments. If you like this video, please consider following my channel. Thank you.